Okay, as a pharmacist in the sub-county, my day-to-day activities are basically to ensure that commodities in the facility are adequate. That is for the FP commodities, the essential drugs also. We also have vaccines and the ARV commodities, and ensure that everything is for the staff members that I supervise. I ensure that first of all, their record keeping is done on daily basis. I also ensure that monitoring of temperatures for the fridges, the room temperatures for the where the commodities are kept is always first of all done first thing in the morning before we do the other things. For the vaccines, we have we have a mechanism in which we ensure that all those are kept in one place, where we have a nurse in charge of the vaccines. For the family planning commodities, we have a nurse who is in charge for the family planning commodities, because they have a separate a whole, we call it a one unit stop shop. So if the pediatrics are coming for the vaccines, they are done all of them in one place. So we have ensured that we moved them from the pharmacy so that we can be able to account for those commodities. For the first time, I've seen a plan that is really working well. As we began this project in October of 2019, definitely the reporting rates for the facilities were quite low, and we couldn't be able to know what is going on in the facilities because there were so many discrepancies from the beginning balance and the ending balances. But when the impact team came up, we were now able to do the follow-up to know when commodities are moving from one facility to another facility in the sub-county level, to explain how patient numbers are being affected with the commodities that we have for the family planning and also for the vaccines. So the impact team has really made a big impact. From the beginning, we were around 90% in the timeliness of reporting, but the problem was not even the timeliness of reporting. The data quality was the biggest issue. But right now, we have seen a total change. Even the ones who are now providing us with the report are starting to own the report, the information that they are providing in the reports, because they know we have to question on the beginning balances and the ending balances. Because now I back as a pharmacist in charge in a facility, and I also back as a pharmacist in charge of a sub-county. So I have two areas that I'm working with. Now, although we have a lot of work when it comes to the first week of every month when we are reporting, there is where we have a challenge. I have to do so many tasks at the same time, and I cannot be able to hand over to someone else to be able to help me, because both are my responsibility. So that is one thing. The workload has really increased. I would wish to get someone else to be able to help me. Apart from that, the other thing that we are doing is I can be able to know what is going on the ground. But now handing over that information, I don't know if I'll be here forever, but we have to find a way to be able to ensure that whoever is going to be around is handed over with the same information, so that this impact team does not crash if any of the members in our group is not available here or leaves or taken to somewhere else. One interesting part is we never interacted to a personal level with someone like the one who is in charge of the records, because we can even be able to scrutinize the information that we are provided together with the person. We also have various individuals, the ones from high volume facilities. We have one incorporated into our group, so we can be able to monitor and see the differences in the consumption of commodities from the large host facilities and even the dispensaries and health centers. So it has made us be able to come together and form a team in such a way that right now everyone knows what is going on in the impact team when it comes to the concerns of family planning commodities and when it comes to vaccines. We never used to know the various differences. Even if we had those meetings, we never got to a point where we would be able to analyze the data specifically for the vaccines and for the pentas, which right now is coming out so clear. If we can be able to get more now of the commodities, if it can be able to be channeled now to the commodities, leave alone filling the information. Those commodities have been coming through the government method where we know that the donors have sponsored for those commodities. One thing I came to realize as I am analyzing that data, you will see a column of requests be filled by facilities because they always assume that those commodities are supposed to come to the facilities at the end of the month. So it brought a picture that whatever they're going to be filling in those reporting tools is what is going to be handed to them. I think we would be able now to get to a level that commodities will always be flowing, because most of these commodities, clients in this case, are requesting for those commodities. We now understand the importance of the information that we have been doing, and now in terms of the request of the commodities that we are being asked, we are asking for. The challenge that we have been having when we report this in the medical supplies list, we honor those commodities only on quarterly basis. Now it brings a problem because you have to do estimations. It is not data driven, it is not client driven, but we wish those commodities will now be coming through, and then before the end of the month we get the supplies so that we can be able to monitor all those aspects when it comes to a monthly basis. The most enjoyable part basically is the interaction between the in-supply individuals together with the impact team. We have learned so much in the process. For the learning packages, I'm planning to finish all of them because I know I can put them into practice in real life. Now, from not just supplies of commodities, I can do it even in my individual life, organize myself. So these packages are also a very important thing that I've come to realize. We are so grateful for whatever InSupply has done for us. Even if we get the support from the county, we will be very grateful about it.